Morning, everyone. Thank you for joining us today and on a Saturday, no less. I think it is 10 o'clock, so we can go ahead and get started right away. My name is Danni Pinnick. I'm the Executive Director of Immunized South Dakota, and we are co-hosting this webinar with Foundation for a Healthy North Dakota. So also on with us is Mary Lizakowski. We're very excited to be doing this webinar specifically for the childcare settings. It's questions have come up a lot for me over the last couple of years, and it's something I've been wanting to do. So I'm really excited that we get to do this. Okay. So I'm just going to quickly introduce our speakers, but before that, just wanted to let you know the webinar is being recorded. The link to the recording and a copy of the slides will be shared after the presentation. You can use the Q&A box to submit questions. And then if you're having any issues logging in or having any issues submitting questions or any issues with any of the resources, or if you have questions that come up after, you can email them to me at info@immunizesd.org, or you can send them to Mary at, is it can you put that in the chat for me, Mary?
Yes, I can put that in the chat, and I will actually open up the chat too, so we can use that as for questions. So if it comes in either way, I'll monitor both.
Great, thanks. Okay, now I can introduce our speakers. So our first speaker today will be Andrea Polkinghorn. So Andrea is the lead immunization strategist for Sanford Health, where she oversees immunization strategy, education, and quality improvement across more than 200 clinics. She also serves as board president of Immunized South Dakota and vice chair of the Sioux Falls Board of Health. Andrea is a passionate advocate for vaccines, driven by her personal journey from vaccine hesitancy to immunization leadership. She lives in Sioux Falls with her husband, 3 daughters, and their dog Diesel. Following Andrea, Danni Pinnick, will speak. Danni is the Immunization Surveillance Coordinator for the North Dakota Department of Health and Human Services Immunization Unit. Her job includes serving as a vaccine preventable disease epidemiologist and subject matter expert, managing the perinatal hepatitis B prevention program, and assessing school and childcare vaccination coverage and compliance. She has served in this role for over 3 years and has been with North Dakota HHS since 2020. Danni has worked in the public health field for 10 years. Prior to this, she worked with Prevent Child Abuse North Dakota and the North Dakota State University Department of Public Health. Danni lives in Fargo with her husband and 2 children. So help me welcome Andrea and turn it over to you now.
Yeah, thank you for having me. I'm just gonna put my slides up. Okay, so I'm gonna start out just kind of like taking a step back. So essentially, what would it look like if we didn't have vaccines? And we can just go back in time. So let's not forget we were just there before we had the COVID vaccine. And so I want to bring you back to that time when people were scared and unsure. In the medical field, we were concerned about not having enough PPE and equipment to care for people. And so this has happened, and coincidentally recently. I think what is different is this is what people used to see, but they saw it in their face. And so that concern for these diseases, which they saw, created these long lines of people wanting to get their child vaccinated. It's a growing hesitancy movement is essentially what it is. And so what I think is primarily different is, I'm going to go to this slide first, actually. The vaccine hesitancy isn't new. So this is an infographic back from when the smallpox vaccine came out, essentially saying that if someone were to get that vaccine, it would turn them into a cow. But what's different now is the ability for people to widely and very quickly disseminate this mis or disinformation via social media. And so when you click this button down here at the time, I could easily share it with 21 sites very quickly. So we started to see this trend, and in 2019, the World Health Organization listed vaccine hesitancy among the top 10 threats to global health. And coincidentally, 1 year later, we had the COVID-19 pandemic. So there was concern, and it came to fruition, and that's important as we go through this presentation today. I think this is really important to highlight. This is Dr. Paul Offit. He's a vaccine researcher, pediatrician, and just very well known as an immunization expert. And he said it's really easy to scare people and it's really hard to unscare them. So when people are seeing this mis or disinformation online, or they hear their friends or family talking about it, it causes them to be unsure about vaccines in general, whether it be safety, side effects, whatever. So what we've seen since COVID is a decline in immunization rates, for sure in the US, but also globally. Globally, they have other immunization challenges like access. We're fortunate here. I think COVID is a good example. We don't have issues with supply anymore, but there's a very small percentage of people who continue to get those vaccines, even though we just got out of the pandemic a few years ago. Why this is concerning from a public health perspective is because of international travel. As immunization rates decline and we're seeing a rise in exemptions for children, primarily, we create this kind of recipe for outbreaks of diseases which were once, either eradicated in the United States or under control and manageable. And so again, we're seeing this come to fruition through the current US measles outbreak. So as of April 24th, if you didn't know, there's 884 confirmed measles cases in the United States. I have listed all of the different states there. A majority of them are primarily in Texas and New Mexico, but because of travel, again, we're starting to see these smaller outbreaks in the other states due to communities where immunization rates are not where they need to be. So in these 884 cases, you can see 97% of them are among people who are unvaccinated, essentially demonstrating that the vaccine works really well, which is why this vaccine, once you've been vaccinated, you don't usually need to be revaccinated. In the US, there have been 3 deaths. And I think sometimes when we hear the number 3, it's kind of like, oh, okay, 3, whatever, that's not a lot. But that is 3 people who died who wouldn't have died had they probably been vaccinated. So I think that's what's concerning. And we have to help people understand sometimes is that's 3 people who didn't have to die if they would have chose to be vaccinated. This was a survey that I found that I wanted to share with you. So it was from the CDC in June and July of last year. It was a survey for parental attitudes and behaviors towards school and daycare vaccine requirements. And the big things that I wanted to point out here is that most, 76.6%, supported vaccine requirements for school and daycare attendance. So I just want to really highlight, I know we hear the opposition groups, those who oppose vaccines or maybe don't believe in requiring vaccines, but a majority do understand and get vaccinated. I think the concerning thing is while their number is small, those who oppose, it seems to be growing, which is why we're seeing declining rates and rising exemption rates. And then again, just since the pandemic, I think that's where a lot of people started to potentially distrust the COVID vaccine just at the speed of which we did it. If you have questions about that, Danny and I are happy to kind of discuss what that really meant. It wasn't that corners were cut or anything. And we'll talk about vaccine safety a little bit later in the presentation today. So again, remember at the end of the day, most people choose to vaccinate. Again, the opposition group can sometimes feel a little bit louder and make us feel like we're doing the wrong thing, but it's the right thing to do. So to get into the vaccine content, I wanted to just hopefully provide you some education to enhance your confidence in speaking about vaccines and why it would be important for your child care center to encourage and support vaccination. So the available vaccines that we have were developed because the diseases that they prevent were causing significant harm, things like disabilities, hospitalization, and death. It's easy to list those, but I'll challenge you to think about what it's been like when a loved one is in the hospital. I think, we get to pain and suffering, financial implications, time away from work, stress, all of that stuff. And so it's much more than just, saying those words. And you'll hear this, like people who had chickenpox. Well, I had chickenpox and I'm fine, so I don't get why people need the chickenpox vaccine. Well, there were plenty of children who were not okay from that disease. It's great that that individual fared okay, but there were kids who were getting pneumonia or getting swelling of the brain and being hospitalized. And so this vaccine was developed to prevent that. And we don't know who is or is not going to get those complications. And so that's why we need all kids to get vaccinated. Another newer example is RSV. So I think a lot of people know someone who maybe has had a child hospitalized for RSV, so it's a little bit more common. But again, it was impacting a lot of individuals. So the industry worked to develop a vaccine to help prevent those hospitalizations for those kids. RSV in the infants can cause inflammation and infections in their lungs, which may require them to need additional oxygen, things like IV fluids if they can't stay hydrated, and as far as like intubation. And so we developed a vaccine to help prevent that. I think something that people don't know a lot about the RSV is that a lot of adults are actually infected. Most fare fine, but as we age, our immune system weakens. And so what they saw was there were older adults that were being hospitalized due to RSV. So that's why we have a vaccine for the older adult population. And then the immunization, the monoclonal antibody for infants, or that mom gets vaccinated during pregnancy. So those are just some different examples of kind of highlighting maybe how people, if they had experience with that disease, feel that a vaccine isn't needed, but it was impacting other people, which is why we developed a vaccine. And it's better to prevent a disease than to treat one after it occurs. So we're all about prevention here instead of all the cost and headache, pain and suffering that goes along with treatment. So vaccines work in different ways, but every vaccine helps the immune system learn how to fight against that specific germ that it's developed for. It can take a few weeks for protection to develop after vaccination. So sometimes you'll hear people say, well, the flu vaccine gave me the flu. Well, there's several considerations when someone says that, but like one thing is, as you're working to develop immunity, you could potentially contract that disease or a similar virus that causes you to feel ill. They don't work completely right away. And then some vaccines provide lifelong immunity, while others need additional doses or boosters because certain bacteria and viruses can evolve over time. They can be very smart. And so a good example of this is like the flu and COVID viruses. They mutate frequently. They're tricky, and they can cause our immune system to potentially not detect that change with the current vaccine. Or it may be more efficient at infecting people. And so this is why like people like the CDC and the scientists are monitoring which strains are infecting people more, and then developing what would be an enhanced vaccine to help combat what we're seeing today. So it's just that the viruses are smart, and unfortunately we have to work after the fact to try to anticipate and or target what we're seeing in the data and science and cases. And so you've probably heard people talk about herd immunity. I'll admit, when I got into this, I really wasn't understanding what it was all about. But essentially, when we have let's say a herd of sheep here, and let's say all the white ones are vaccinated, but the brown one cannot be vaccinated because of age, or maybe they're immunocompromised. By vaccinating all of those around them, essentially you create this herd effect where the virus is not likely to infect that individual because all of the other ones are protected. And so that's what we really work to achieve through vaccination. And the more white sheep, for this analogy, the better the protection can be. And so, like I talked about, some of those people who would be the brown sheep would be newborns who aren't eligible for vaccination yet. You know, we give that dose of Hep B at birth, and then we typically start shots around 2 months of age for most infants. And so during that time, they are susceptible. Additionally, we're just starting shots then, so they're particularly more vulnerable if they were to contract something. And then people with certain chronic conditions, things like diabetes, heart and lung conditions, if they're immunocompromised, those are some of the other individuals who may be at more of an increased risk. So the more people who are immune, the safer everyone is, especially in group settings like daycares where illnesses can spread very quickly. Just to talk a little bit more about babies, because you probably see them often. A baby's immune system is not fully developed at birth, and so they're at a greater risk of becoming infected and getting seriously ill. This is why we have some vaccines which are recommended during pregnancy, and that's to protect baby from the time they're delivered until they can start to receive those vaccines themselves. And then just to talk a little bit about the schedule, there is only one true trusted immunization schedule, which is intentional in its development. And so the CDC recommended schedule balances when a child is likely to be exposed to a disease and when the vaccine will be most effective. So there is data and science behind why we recommend certain vaccines at certain ages. So why do we require vaccines for daycares and or school settings? It's especially important that immunization rates are high when there's a lot of people in a particular settings like a school or a daycare. And that's because these diseases can spread quickly because there's so many people in this confined space. Additionally, kids have a limited ability to perform proper cough and sneeze etiquette and hand hygiene. Childcare centers need high vaccination rates because young kids are more likely to get seriously sick from vaccine preventable diseases like measles, whooping cough, and flu. And then when most children are vaccinated, it helps protect everyone, including babies and kids who can't get certain vaccine yet. So it's going to stop outbreaks before they start at your facility. So if you're going to, or you have really encouraged vaccination at your facility, I just think that one of the ways that you could do this is to help people understand what would happen if you saw an outbreak. There were schools that closed during this flu season because they had outbreaks of influenza. And so this is a real risk depending on immunization rates for each facility. But to help explain, so here in our daycare, if we were to have an outbreak of influenza, it could spread very quickly, and then you're going to have kids who need to stay home, their parents or guardians who are going to need to take time away from work to care for them potentially. I think it's a lot of headache and stress for administrators, potentially loss of revenue, And then for the people who are infected, that's not fun to have influenza, high fever, coughing, sore throat. But it can also lead to things like pneumonia, hospitalization, and death. We already talked about the rest of that. I think you can also advocate by sharing a story. So this is Gianna Weirkamp. Her mom is a member of Immunized South Dakota. She's a strong flu advocate. And Gianna unfortunately passed away from influenza. She was a completely healthy child, and it was in a couple of days. She died from the flu. And on average, there's around 200 kids that die from influenza each year. Again, I think people think, well, in relation to the US population, that's not a lot, but those are 200 kids who probably didn't have to die if more of them had been vaccinated. Because most of them occur in the unvaccinated population. So I just want to point out that you are a piece of the puzzle. I think the more people that we have encouraging and speaking about the importance and value of vaccines, it's going to help increase confidence when they're hearing that message from multiple places. I think it's really important to help staff and parents or guardians understand why you value high immunization rates at your facility. And you actually may be quite useful or most useful in improving immunization rates because you have such a high frequency touch with all of these kids. A majority, I'm assuming, come nearly every day. So even at a minimum, if you're just promoting or encouraging vaccination, for example, each flu season, like, hey, it's flu season, now we encourage you to take your child in to get their flu vaccine to protect the health of all the kids at the daycare or something like that. Or if you potentially have the ability to require something like the flu vaccine for the kids at your daycare. I think it would be great too if potentially you sought an opportunity to have a vaccinator come on site to provide vaccines. It can be challenging for some people to get away from work. And that's kind of what happened with Gianna is the mom, the dad, and the brother had all been vaccinated. The parents were vaccinated at work, and the son was vaccinated at school, and they just, time got away from them, and they never got her in to get her vaccine. And so that's something that Angie likes to talk about. And so I think these on-site vaccine opportunities can, potentially help a lot of people who maybe just wouldn't find the time. But if you're going to offer that, then they would be willing to get their child vaccinated. So I want you to think of vaccines as another tool in your toolbox. Sorry, I'm just checking my time here. So just like you have safety locks on doors and cabinets, and you're using disinfecting wipes or solutions for the toys and surfaces, vaccines are like that. They're just another tool in your toolbox to protect the health of the people in your facility. And so by maintaining high immunization rates among individuals at the center, we reduce the risk of spreading these diseases and potentially causing an outbreak. One thing I want to touch on is we talk a lot about the children who are in your care, but it is equally important that the staff are being vaccinated too. If a child care worker is unvaccinated, they could unknowingly bring harmful diseases to the facility, exposing children to these diseases. So I think you got to think about it two ways, just like us in healthcare, which is your staff, and what risks do you put the people in your care at if you don't have a vaccinated workforce, and then the individuals you're caring for. So I just went and pulled like some language that I wanted to share that you could use if you wanted to pursue something or were unsure where to start. And this is just some scripting you could use to talk to your staff about why you're going to encourage them to be vaccinated. So getting vaccinated isn't just about protecting yourself. It's about protecting the little ones in our care who are too young or medically unable to get certain vaccines. When we stay up to date on our shots, we help keep our daycare safe, healthy, and open. It's one of the easiest ways we can show up for our kids, our coworkers, and our families. I'm almost done here. I just wanted to touch briefly on safety. So this is an image from the CDC about the life cycle of a vaccine. And I just want to point out, so this vaccine development phase can take 10, 20 years. It takes a long time for a vaccine to be developed traditionally. And then it goes through the review process. And a vaccine is only approved for use if it's proven safe and is proven effective. And the last thing that I really want to stress on the safety is that the CDC and the FDA continue to monitor the safety of vaccines after they're in use. So we have several different, not just VAERS, if you've heard of that vaccine adverse event reporting system, but there are several other safety monitoring systems that they have to monitor for any potential safety signals after we're out vaccinating an entire population. Coverage, this is my last one. We wanted to be sure you were aware about the Vaccines for Children program. So if a child does not have insurance, there is the Vaccines for Children program available to them. So healthcare providers have to sign up to be a VFC provider, but most clinics, I would say, who are seeing kids usually have knowledge of this and sign up to provide these vaccines. All the vaccines which are recommended for kids are available through the Vaccines for Children program, and every state has one of these programs. So essentially, the government purchases the vaccine, and then the vaccines are provided to eligible children at no cost to them. The one little caveat is the provider who's giving the vaccine can charge an administration fee, but if the parent or guardian cannot pay that fee, the charge must be waived. So wanted to make sure you're aware of that. And then children who are eligible for the VFC program are children 18 years or younger who meet at least one of the following requirements, which is they're either American Indian or Alaskan Native, they're on Medicaid, or they're on or underinsured. And underinsured just means essentially that they have insurance that doesn't cover vaccines or certain vaccines, or they would essentially charge them some amount of a fee for vaccines. And if they're underinsured, they do have to be vaccinated at a FQHC or an RHC. So if you're in Sioux Falls, an example would be Falls Community Health downtown. But we can always help put you into contact with someone in your area too. And then if you're talking to families about this, they do not have to show proof, but the healthcare provider will ask them a couple of questions, like if they're on Medicaid, if they have insurance that covers vaccines, or they're American Indian or Alaskan Native, and that's just because of answers that they have to put on their documentation for the state. So they don't have to prove it, but they will have to answer those questions. And I am out of time, so I will let Danni take over.
All right, I just unmuted. Can you hear me?
Yes.
Perfect, thanks. All right, so again, my name is Danni Pinnick. I work on the North Dakota side for HHS Health and Human Services in the immunization unit as our surveillance coordinator and vaccine preventable disease epidemiologist. Today, we wanted to cover also the side of childhood immunizations as it relates to daycare and K through 12 requirements and some of the aspects around that. So my learning objectives for today, oh, hold on, let me move this part of the screen. Okay. We want to talk a little bit about, like I said, immunization requirements for childcare and school settings in both North and South Dakota, although my disclaimer there is that I'm an expert on the North Dakota side. So if there are additional questions about requirements or how things play out in South Dakota, I would refer you to South Dakota Department of Health. And we're also going to look at the impact of what immunization looks like and how it helps these settings, how it helps support operations and make people safer and less stressed by this kind of thing. So I think that because COVID really prompted people to talk about vaccines, good and bad, there has been a lot of discussion about school requirements for vaccines in the last 4 or 5 years. People that would or wouldn't like, different vaccines like influenza or COVID to become part of our childhood vaccines that we recommend or require for school. But school requirements go back to the 1800s. Boston was the first city that required children to be vaccinated before going to school. And back in those days, the only vaccine they really had was the reason we call it vaccine was vaccinia. It was basically we gave cowpox to people to prevent smallpox, and that was a very, very useful and incredible discovery invention because that, as you probably know, helped smallpox decline precipitously and then is actually now eliminated from the earth. I will also say if there's any nurses among us, I know that this is not how smallpox vaccine is given. It's actually in these days would have been poked in with kind of like a tiny little fork needle thing. And these days we have safer versions of orthopox, smallpox vaccines that can be given, but just a side note. So this was the standard by the early 1980s. So all 50 states have laws requiring vaccinations now, and that has been the case since, the late 70s, early 80s. And we have simply added to these as we've developed new vaccines. So if, for instance, my parents growing up, probably smallpox, maybe, and then eventually polio, once that was invented, were the vaccines that they were able to be given. And I think maybe eventually started being able to get tetanus, stuff like that. But for our kids, or for my generation, I was very fortunate that I grew up in the days of having most of these. So it was DTP at that point, polio, MMR. They didn't have chickenpox when I was a kid, so I got chickenpox. Don't recommend it. I had shingles a couple of years ago. It's not fun. So now our kids don't have to even deal with that. And we also prevent Hep B and Hep A. And we don't see many of these diseases anymore. So like, Andrea alluded to, because they're not on our radar, we're not really thinking about them. Because why would we, right? I mean, unless you're in like our role, I'm paid, I'm hired to think about these diseases like 40 hours a week, right? But most people aren't. They're doing your own thing. So it's understandable. We all have our biases. So that's where we're coming from when people like me are really, really pro-vaccine and really almost have to like get into the brain of someone that doesn't like vaccines when I'm having conversations and kind of remember, okay, this person is taking care of their healthy child. They don't want to think about having to poke them with a needle. That's fair. And Andrea talked about this a little bit as well, or actually more than I'm going to talk about it, but the Vaccines for Children program has been really instrumental. Not just the fact that we have vaccines has made vaccine preventable diseases almost, eliminated, at least from the public eye or for the most part, but the Vaccines for Children program, which was implemented in the 1990s, also then took away a lot of the disparities that existed for immunization. So for a while, we would still continue to have outbreaks of things like measles, and that would mostly happen in people that were low income or disparaged in some way that they couldn't afford or didn't have time to go to get vaccines. And so that really helped close that gap. And if you take a look at like some of the metrics for the Vaccines for Children program, it's the cost savings has been almost unimaginable. Like I think the publications they do on this every 10 years estimate something like $2 trillion, like trillion with a T, of direct and indirect cost savings from the Vaccines for Children program. So one of the very, very important federal programs that we have, it's an entitlement program that basically says if you live in the US, you are entitled to have one of these vaccines, all of the ones that we give to little kids, because we don't like it when kids die. And we don't like it because kids are unvaccinated, they can spread a disease, right? It's good for everyone. I put a link here to the North Dakota side of VFC, and South Dakota has these resources as well. Like we said, most pediatric providers, a lot of family medicine, most people, most areas at least have some coverage that offers what's called state supplied vaccine. That's the BFC vaccine. Like I said, so when the vaccines have been introduced, we've really seen cases come down precipitously. I give a caveat or a disclaimer about this. Sometimes you see graphs like this used against disease mortality, so the number of people that were dying from something like measles, and you see a drop in the 10 to 20 years before that vaccine was licensed. That's because that's when we started to use antibiotics, right? So around World War II, we discovered penicillin and all those things before that didn't really have effective ways to treat people who had secondary bacterial pneumonia and other complications from these diseases. And so people stopped dying, but people were still getting this disease. And so after the vaccine is licensed, just incredible progress was made against that. In 1989, we added a second dose recommendation and this is just for MMR vaccine and varicella as well. The reason why we give a second dose now is because this is an amazing, outstanding vaccine. Someone can actually get completely immune to measles, mumps, and rubella after their first dose. In fact, most people do. But what we do at the second dose is we give the immune system another opportunity to seroconvert or develop immunity to that vaccine. And so that's why if we talk about quarantine recommendations, someone is actually exempted or doesn't have to quarantine if they've had even one dose of MMR vaccine, because there's a 90% chance that they are immune to it and they're not going to get that disease. And then the U.S. declared elimination of measles in the year 2000. We are dancing with that line now. We might lose our regional elimination status. If this outbreak that's happening right now continues for a full year, then we won't be a country in which measles is eliminated anymore, which is really sad. That's just moving backwards on this disease that really we should have turned the page on many years ago. So switching gears now, so I understand most of this group is childcare providers, daycare providers, early childhood education, pre-K. These are, probably you're familiar with this schedule, right? This is what is required for immunizations for little kiddos in childcare. And when we compare this to the K through 12 requirements, you look at that and you kind of realize the K through 12 folks might have it a lot easier than the daycare folks, because what you're dealing with, depending on when your babies or children are enrolled, they are maybe, sorry, I lost my mouse. Maybe they're 4 to 5 months, 6 to, they're here. So if they're on schedule, they've probably had 1 or 2 of these doses. And then you're kind of required to know when they had their 3rd one, when they had their 4th one. So it's really tricky, I understand. But it is very, very important that we're communicating with our parents and making sure that the children in your care are caught up based on age. Because like Andrea said, the reason why we vaccinate at these young ages is because every single one of these diseases is a child murderer. It used to be super, super common that kids would die from a lot of these things, young babies. In fact, we've had pertussis outbreaks in the last few years, and even in North Dakota, we've had infants, newborns, become very, very dangerously close to mortality as a result of pertussis. So it's scary, and we see a lot of complications from things like pneumococcal disease, that's a bacterial disease. Rotavirus in the days when I was growing up was extremely common. Almost everybody got that. It can, very severely dehydrate people, make them really, really sick. So all of these, the timing is really important. So whatever we can be doing to encourage parents and families to stay on schedule with these, the better. And of course, exemptions are allowed as well in the Dakotas. It's just a little bit different. So every place has a medical exemption, right? Meaning if a doctor says that you can't get this vaccine for because there are reasons why some people shouldn't get certain vaccines, right? If you're immune compromised, you can't get a live vaccine. If you're allergic to something in a vaccine, you can't get it. So if your doctor says they can't get it, that is of course going to be allowed. The other sort of medical reason why you might not need a vaccine is because if you had that disease, right? So a lot of your staff, if they're thinking about it, it's not a requirement for staff, right? But if they're wondering if they've had the chickenpox vaccine, most people like my age, around my age, probably haven't, right? Because we all had that disease as a kid, and we're considered immune to it as much as we can be, going forward into our lives. So there's stuff like that, or kids that grew up where chickenpox was a lot more common, and we do see things like chickenpox happen here and there, and that's specific to the disease that we're talking about. So it's almost always only used for chickenpox when we talk about history of disease. And then we do have non-medical exemptions, and those are classified by a kind of religious or personal belief. In North Dakota and South Dakota, they have religious exemptions. In North Dakota, we have philosophical or personal belief. It's kind of what we like to call those, like more colloquially. We have those. In South Dakota, they do not have those. So in South Dakota, you would need to have a religious objection to a vaccine. And then the way that you furnish proof to that is a little bit different depending on the state. So I'm going to show you a little bit, maybe talk just a little bit about how these requirements play out in the K through 12 setting as well, because these are your kids until they get to these ages, right? And you care about them. You love your kids that you're taking care of. You don't want them to get these diseases later in life too. So the vaccines that they get in the pre-K setting, the daycare setting, are very, very important to kind of set them up for success when they're going into K through 12, because most of these look familiar. These are the vaccines that we required for daycare too, right? Minus a few that are most applicable to very young kids. The main thing that people have to do to get kindergarten ready when it comes to vaccines, if they've been on schedule, almost everybody's already if they're on schedule, they're done with hepatitis B. For kindergarten, they would need their second varicella, second MMR, fourth polio, and fifth DTaP or DTaP. Those are combined into vaccines. So it's actually 2 pokes for most kids because they're going to get MMRV as a combo. And then the DTaP, polio, and sometimes they throw in like a 4th Hep B for good luck in that vaccine. And then you're done. You're ready for kindergarten. We don't require meningococcal disease or Tdap is the booster that we give like for tetanus and pertussis years after they've gotten this initial series. When they go into 7th grade, that's a pretty easy year to get prepared for school as well, right? They're just getting their meninge and their Tdap. And then in 11th grade, they just need a second meninge. And then these are school requirements. There are vaccines above and beyond this that these children's doctors will recommend they get. And that might include the meninge B vaccine. There's some this might be combined with the 4-valent meningococcal vaccine that we give teenagers. Meninge B is something they might deal with more like in college, and so sometimes we will give that one a little bit in the later years. But anyway, it looks a lot more complicated than it is. I think that most parents will just be well advised to just follow what their doctors and their nurses, their care team is recommending for them. They'll keep you on schedule. These parents will be ready to go, or these kids will be ready to go when they're school age. And then, of course, some daycares are going to have school agers in your care. As far as you're concerned, on the North Dakota side anyway, we do want you to know the immunization status of those kids, because in something like an outbreak setting, we will want to know who should be quarantined, who's safe, who might need to stay home. And that will take into account whether or not your school agers have been vaccinated against MMR. So even though it's a daycare requirement, they have just the first dose. Your 4, 5, and 6-year-olds probably will have had a second dose of that one as well. A little bit more about exemptions and enforcement in North Dakota. Again, we have medical, personal belief, and history of disease exemption. This is how people would get one of those exemptions. In the K through 12, or excuse me, in all these settings, they're not usually just sending them to us at the State Department of Health. They're usually filling out whatever certificate they want to furnish for this and then giving it to you as their provider. For enforcement and the K through 12 side, our law actually does say that children must be up to date by October 1st or they're going to be excluded from school. This plays out a little bit differently in every different school district because there are certain situations where families are trying to get vaccinated, but they have like a minimum wait period. So there's, provisional admittance and some schools are like more lenient on this because it's not our goal to keep kids out of daycare and school, right? We want them to be there. So for, when it comes to this stuff, it varies a lot by the situation. And then on the South Dakota side, again, I'm not an expert on this stuff, but this is just what I took directly from their website. The important thing to know about a medical exemption is that the signature has to be from an MD or DO. So it has to be from, hold on, licensed physician. So that would be MD or DO would be their credential in order to qualify them to give someone an exemption. It is specific in South Dakota. It can't be a nurse practitioner, can't be an NPPA or DO, or DC, doctor of chiropractic. I think that's the credential. So those will not work. So MD-DO is it for medical exemptions in South Dakota. And then religious exemptions, again, are the only other exemption you can get. And then it's a written statement by the parent or guardian about the child being adherent to religious belief that is opposed to immunization. And they do not have personal belief exemptions in South Dakota. At the moment, this is all subject to change because laws change all the time, but this is how it stands right now. And then the way that they enforce that in South Dakota is that the Department of Education does audit files to ensure that a school has records on every student that's in their care. So I wanted to talk a little bit about the impact of these diseases as well, as Andrea did too, but just kind of like this is just a little summary taken out of our exclusion document for childcare in K through 12 in North Dakota, just to show you, like, for all of these vaccine preventable diseases, the impact that they have on when people are sick, how long they have to stay away from their school or daycare environment. And then also, even if people are not sick, but they've been exposed to disease, in the case of measles, requires a very lengthy quarantine period. And so this is something I think maybe daycares and schools are less aware of. If there's a positive measles case in a daycare, everyone that was exposed to that person who is not immunized needs to quarantine for 21 days, which is a long time. Like, think about 21 days ago. It was like a lifetime ago. At home without leaving for that period of time in order to make sure that they don't spread measles to the community. However, most of these people, like if we're talking about a daycare setting with little kids that are not immunized and an infectious little kid that's been around them all day, most of those kids are going to develop measles. So that's actually the more scary thing when it comes to that. But the quarantine period is considerable too. That's going to have a huge impact on us. This is taken directly from the South Dakota Department of Health website as well. It kind of talks a little bit about vaccine preventable disease. Some of these are vaccine preventable, how these are implemented in the school and daycare settings in South Dakota as well. And these documents are up on their website. I think we're probably sharing these slides afterwards for anyone that's interested. So Andrea kind of touched on the toll of measles. Even just this year, we have seen 884 cases, and it's not even the end of April yet. That is way more measles cases than we had in 2024. Most of these people are children, so under age 19, and vast majority are unvaccinated. The hospitalization rate usually is more like 20%, but in this case it's 11%, possibly because of how many adults are getting measles in this outbreak. And then, like Andrea said, 3 people have died from measles, and these are all confirmed deaths now. 3 people have died from the measles this year. That is unheard of in the United States. People don't die from the measles in the US. The last time someone died from measles, and this is tragic too, but In 2015, an adult who was immune compromised caught the measles and died. And then before that, I forget like how the mortality had gone before that, but it had been a very long time since a otherwise healthy child died from measles, and now we've had 2 children that have died from measles in this year alone. So again, these are unnecessary deaths. These didn't have to happen. So I wanted to just talk really quickly, if I have time, about what a measles exposure would look like in a daycare. This is hypothetical, but if you had, for instance, an index patient who has measles, say this is like a little girl, like 8 months old or something, that is too young to have been vaccinated because she would have gotten her first vaccine at 12 months. So she's not routinely vaccinated. So if she was in the care of the daycare, say from like the 27th of January to the 30th, but she didn't start developing symptoms until like the 31st, and that's when mom or dad or whoever first kept her home. Once we have diagnosed that person with measles, we're looking at that whole period of 4 days right before they developed their rash as what their infectious period was. So remember, we did this a lot with COVID. With measles, it's a nightmare because it is 4 days and it's everybody that breathed the same air with that person over that 4-day period. So that could have been, when we interview these people, we have to ask them like, did you go to Walmart? Did you go grocery shopping? Did you go to restaurants? And then we have to put a like press alert about every single place where they went and when they were there. And then the infectious period of that space goes until 2 hours after they were there. So that's how infectious measles is. It's incredible. But the kids in the daycare in this scenario got very, very exposed to this little kid while she was infectious. What that would mean is that all of the children who are not vaccinated or any people in that scenario who have not gotten at least 1 dose of MMR need to quarantine. So in this case, I've said that that's 9 babies and 3 toddlers, right? That's a scenario we maybe see in some of our daycares. And then, like I said, 9 out of 10 of these kids will progress to measles from that exposure, and 1 or 2 of them will require hospitalization because 1 in 5 kids need to be hospitalized for this. So that means that from our 1 index case, and this is what the daycare kids look like. This isn't even the staff. We have, what is this? 9 kids that have to, or excuse me. All of the ones that are darkened here are quarantined children. So that is 9, 10, 11, 12, right? 12 kids that are quarantining. So they're staying at home for 21 days, but they're not just quarantining. Most of them are going to get sick from measles. So 90% of those young children will get sick from measles. So in this case, it's about 9. And statistically, 2 of them will end up in the hospital. This is a very likely scenario for a daycare, right? Because all these infants, none of them have been vaccinated. And so that's why it's so contingent on all of these older kids who can be vaccinated, our staff and our community at large, to be highly vaccinated against measles, because we really need to prevent this index case in order to keep all these kids safe. And then I have some additional resources at the end. These are stuff that we like to use. And of course, you can always call us at the immunization unit on the North Dakota side, and email me personally if you have questions about this, or how things need any advice about all this stuff in North Dakota. And some of these are very well used and reliable resources, especially NDSU CIRE. We partner with them very closely in order to do educational opportunities. Okay, I'm gonna stop sharing my screen, and I think we have a little bit of time for some questions.
We did have one question come in, but I think it has been answered with some of the handouts that have been provided, which is great. But it was, what are some symptoms of RSV for the elderly? But thanks, Andrea, for putting that in there. So that was our one question that came in. Do you have anything to add?
Yeah, Sue, I think it was you who sent that. I think it was on my slide, but I didn't speak to it. I think that's why it's likely underreported in a lot of adults. They probably have it, but think it's just the general cold. And so as they evaluated data, you know, they saw that those older adults were being more greatly impacted by being hospitalized. And so that's why we have that vaccine for them. But yeah, just kind of like cold-like symptoms. So likely a lot of people just aren't even getting tested, thinking they just have a bad cold.
We do have a question from Jennifer. If you have a home daycare, could you put in your policy book that all infants and children get their immunizations or they will not be able to attend? She said she has a family of 2 that decided they no longer want to get them.
Yeah, that's tricky. We do see that a lot with, I shouldn't say a lot, like Andrea said, the vast majority of people vaccinate, but maybe 5% of parents that you'll see their immunization history goes up to like 12 months or something, and they just stopped. I mean, it's you as a private business, I imagine can do that. I think there might be, I don't want to answer like a legal question or anything here, so you might want to consult with, if you have an attorney that you've worked with for, your daycare policies and your contracts and everything. I would think that the safest bet would be to make sure it's in your contract and stated very plainly that this is going to be a requirement. But I mean, this is for public health reasons. You have just as much of an obligation to protect your young babies. Like I said here, we're not, immunized against measles because they couldn't be from those diseases. So it's, it's like the trolley problem, right? Like the personal rights of 1 or 2 kids versus the potentially life or death of 8 or 9 kids. So I would say that's something you should definitely promote in your daycare if that's a choice that you want to make, but maybe seek some advice from your licensor and personal attorneys.
I was going to say the same thing. I think as long as it's part of your contract with them and they know that it's an expectation of yours, I think they would have to oblige. Again, I'm not a lawyer, so I would consult with them. The other thing I would think, if you look to include something, is like some type of clause, right? Like if they're not compliant by X amount of time, then they choose to forfeit their spot, and then probably put your payment in there, like whatever your requirements are for that. Yes, and I don't think I spoke to that. So the recent information around exemption rates is nationally we're at 3%, which is the highest it's ever been. But there are some schools that reported an exemption rate of 5% or more. And that is when you're truly vulnerable to an outbreak. Danni has an MPH, I do not. So I don't know, Danni, does that differ on like the amount of people in each facility, that 5%, or is it across the board?
It would definitely matter how many kids are. So if you're talking about a school that has 4 kids, and then one's not vaccinated, there's no way for that to cause an outbreak. Only that one is probably going to get sick.
Sure.
But yeah, absolutely. In bigger settings, and we do have that data, and South Dakota publishes that as well by school. So you can kind of see in like larger settings, kids that are unvaccinated or undervaccinated, how that might look if there's a measles exposure in that school. That herd immunity or community immunity threshold, that 95% really mostly applies to measles too, because of just how incredibly infectious that disease is. And we like to talk about that one because it's a very, very infectious disease and a really, really, really good vaccine. So, it's almost certain that you're going to get measles if you aren't vaccinated. It's almost certain that you are not if you are. A lot more certain, I guess. But yeah, if we have, I guess the other thing too is that we kind of want to look at that regionally, because we might have across all of North Dakota or South Dakota might be like 90% immunization rates or something, but you'll have counties in northeastern North Dakota that have like 100%, and then southwestern North Dakota that have like 70%, right? And these kids are unlikely to expose each other unless there's some event that they're all going to. So those are kind of the dynamics of how that would spread in that situation.
Thank you for that. We have Julie that made a comment. We had an instance where a child's family fought it with the religion answer, and they had to forfeit their spot.
That would be a good thing to put into your policy if you develop one also, is like what exemptions you'll allow there are not that many true medical contraindications to a vaccine. As far as religions, Danny, is it that there are no true religions that speak to the opposition of vaccines? Or is there one or two?
I
It's almost
think
none.
specifically vaccines, I think what Paul Offit has said repeatedly is that Christian scientists
Okay.
are like have a specific thing. And I think what happens is people make a case for Jehovah's Witnesses because of what they believe about organ donation. And then Catholics is obviously a huge one because of cell lines that have been used to derive to make vaccines. That's one that I know NDSU Siri has some education on. If and when it comes up, just because it kind of becomes a hot topic in some places. But I think the most important thing to know there is that there are not new fetal cells being taken from people these days to create cell lines, that the cell lines that are used for viral replication are from cells that were taken or that were derived like 50 years ago. And then those can be replicated. So there's not like new pregnancy terminations happening to develop those cells. And I know that the Catholic Church has made statements about how, the good that you're doing by getting a rubella vaccine is really outweighs how you might feel about that cell line, because ironically, rubella the main thing that's used on that kind of cell line, it is a disease that is mostly dangerous to pregnant women and causes birth defects, and it causes stillbirth and deafness and other really severe pre-birth effects in children. And so it's better for for children and fetuses and babies in general to be getting that vaccine and giving it to your kids.
All right. And there is an evaluation survey in the chat too. So if everyone could take that, that would be great. And I will hand it off to Danny Gullickson for closing, since we have no further questions in the chat.
Thanks, Mary. And thank you, Andrea and Danny. It was very, very valuable information. We're really grateful to you guys, especially again on a Saturday, to hop on and share all this information with us. Hopefully everyone found the information helpful. Again, if you have a minute, please take the evaluation. It really helps us know if the trainings that we're putting out are helpful to you. But with that, I think we can wrap up and let everyone get their weekend started. So thanks so much.